ancient times, when stone needles were used, to the time when the 9 needles were made, needling manipulation is an important component in acupuncture, and Moxibustion therapy has undergone a long history. Acupuncturists have made tremendous contributions throughout the successive dynasties. They have not only accumulated extensive clinical experience, but have left behind some monumental works as well. The most influential among them are the Neijing, the Nanjing, the Jinzhenfu. Classical needling methods. The publication of the Huangdi Neijing had epoch-making significance in Chinese medicine and acupuncture. Many chapters were devoted to an extensive account of the contents of acupuncture, especially of certain needling techniques. Somewhere between the time stone needles were used and the time when the 9 needles were developed, formal needling methods were established. Among the 9 needles, the filiform needle was regarded as the principal one and was most extensively used. The needling techniques we will discuss here mainly refer to the classical needling methods practiced by using the filiform needles. Needling methods discussed in the Neijing and the Nanjing. Ling Shu Guanzhen records employing 9 needling methods, 12 needling methods, and 5 needling methods to treat different disorders. It also discusses the locations, depth of penetration, the number of needles used, angles of insertion, methods for point location, etc. The 9 needling methods. This discusses the 9 different ways to insert the needles in order to treat 9 pathological patterns. Shoe point puncture. This method uses the inspring points and shoestring points below the elbows and knees of related meridians, as well as back shoe points to treat diseases of the 5 Zang organs. For instance, Taiyuan is the shoestring point of the lung meridian, and Fei Shu is the back shoe point of the lungs. These 2 points can be used to treat pulmonary diseases. Distant puncture. This method uses the principle of selecting distal and lower points along the affected meridian to treat disorders in the upper part of the body. Generally, this method is used to treat diseases of the 6 fu organs. For example, Zhu Sanli is chosen to treat gastric problems. Meridian puncture. This method selects and needles only those points along the affected meridian to treat qi and blood stagnation along the meridian. Diseases include regional blood stagnation, nodules, and areas painful to pressure. Collateral puncture. A method used to bleed superficial small collaterals which show signs of blood stagnation. The 3-edged needle and the cutaneous needle methods fall within the scope of the collateral puncture. Crack puncture. A method used to insert the needle directly into deep muscle to treat muscular paralysis and soft tissue strain. Evacuation puncture. This method removes purulent blood and fluid by incising and draining and is primarily used for topical diseases. Shallow puncture. A method whereby the skin is punctured superficially. In ancient times, this method was performed with arrowhead needles. Presently, the cutaneous needle and the needle roller are used for this purpose. Contralateral puncture. This method selects points on the left side to treat the affected region on the right side and vice versa. For example, Hogu on the left side is selected to treat facial paralysis on the right. Fire puncture. A method whereby the needle is heated until red and then inserted into the point. It is used to treat cold bee syndrome, scrofula, and ulcers of an in nature. The fire needle method of today developed from this method. 12 needling techniques. This refers to 12 kinds of needling methods used to treat pathological changes in the 12 meridians. Coupled puncture. A method using the anterior and posterior points or the yin and yang points in combination. Utilization of the front mu point and the back shu point to treat diseases of the zangfu organs is of this category. For example, zhongwan and wei shu are used in combination to treat gastric problems. Trigger puncture. A method whereby painful points on a patient's body are directly needled. For example, insert the needle into the spot until the pain disappears. Then withdraw the needle and insert it into another painful spot close by until the pain disappears or decreases. It is often used to treat pain syndromes of an unfixed nature. Lateral puncture. A method whereby the needle is inserted into the region where the patient experiences muscular spasm and pain. The needle is lifted to a shallow position after the arrival of the needling sensation and then reinserted in multiple directions while simultaneously moving the patient's joints. This method is applied when the body or limbs are moving. Triple puncture. A method whereby first one needle is inserted into a point, and then two other needles are inserted laterally to the point. This method is suitable for treating painful bee syndrome in a small and deep region. Quintuple puncture. In this method, one needle is inserted into the point, and then four other needles are inserted laterally, anteriorly, and posteriorly to the point. This method is suitable for treating bee syndrome caused by the invasion of a cold pathogen to the superficial level. The modern tapping method of the plum blossom needle is evolved from this method. Perpendicular puncture. The needle is inserted subcutaneously by pinching up the skin around the point. Currently, it is called the subcutaneous or horizontal insertion and is suitable for the treatment of the pathological changes in superficial areas and collaterals. Shoe point puncture. In this method, the needle is inserted perpendicularly into a deep position and with the arrival of the needling sensation, then withdrawn slowly. This is a method used to draw yang out of yin and to expel pathogenic heat caused by excess heat due to qi hyperactivity. Short puncture. Slowly insert the needle by shaking the needle and then lift, thrust, and twist the needle slightly near the bone to expel pathogenic factors in bone bee syndrome. Superficial puncture. Insert the needle obliquely and then penetrate into the muscle transversely for treating muscular spasms. The modern subcutaneous needling method evolved from this method. Yin puncture, a method whereby Tai Chi is needled bilaterally in the treatment of cold limbs and cold conditions. Now it has been changed to needling the point on bilateral sides simultaneously in order to obtain better therapeutic results. Side puncture, a method whereby the needle is inserted first perpendicularly and then another needle is inserted obliquely nearby. Similar to the triple puncture, the purpose of this method is to increase the stimulation in the treatment of local tenderness. Repeated shallow puncture. In this method, the needle is inserted shallowly and then withdrawn quickly to cause bleeding by repetitive and scattered shallow insertions. Similar to the collateral puncture in the 9 needling methods, it is used to treat carbuncles and erysipelas. 5 needling techniques. These were developed by corresponding the 5 zung organs with the 5 tissues. Extreme shallow puncture. Insert the needle shallowly just beneath the skin and then quickly and completely withdraw the needle to expel pathogenic factors from the shallow position. Currently, this method is often used in pediatric and cutaneous needle therapy. Leopard spot puncture, a method used to sedate the blood collaterals by pricking the needle around the point. Similar to the collateral puncture and the repeated shallow puncture, this is a type of shallow needling bleeding method. The leopard spot puncture can be used to treat syndromes which present with redness, swelling, and feverish pain. Joint puncture, a method to insert the needle into the tendon near the joint for treating tendon B syndrome. It is advisable to avoid damaging the blood vessels and causing bleeding. Hogu puncture. Insert the needle to a certain depth in the comparatively thick muscle, then lift the needle to the shallow position, followed by inserting the needle obliquely towards the bilateral sides in turn. This is used to treat muscular pain syndromes. Shoe point puncture. The needle is inserted directly and deeply to the bone and then withdrawn directly. Similar to the short puncture and the shoe point puncture in the 12 needling techniques, this is used to treat bone B syndrome. The Nanjing is a well-known masterpiece on medicine from ancient China. Based on theories from the Neijing, the book's format is arranged according to a series of questions and answers and covers a wide range of topics. From question 69 through question 81, it mainly talks about how to apply tonification and sedation needling techniques. Using tonification or dispersing methods and their relationship to the protective and nutritive qi is one of the most important discussions in the book. In question 71, it points out that when needling the nutritive, one shouldn't damage the defensive. When needling the defensive, one shouldn't damage the nutritive. The defensive refers to the superficial level, and the nutritive refers to the deep level. Defensive level diseases should be treated with subcutaneous and shallow insertions in order to avoid damaging the nutritive. Nutritive level diseases should be treated first by pressing the points with one's hands to disperse the defensive qi. Thereafter, the needle is inserted deeply to avoid damaging the defensive qi. Based on this theory, question 76 discusses tonification and sedation methods. The tonification method. Insert the needle shallowly, wait for the qi at the defensive level to rise, then insert the needle to a deep position after the arrival of the needling sensation. By so doing, one can guide qi from the defensive level to the nutritive level. The qi thus obtained is pushed inwards and received by the interior level. The sedation method. Use the left hand to press the point first, then insert the needle with the right hand. After the arrival of the needling sensation in the deep position, lift the needle to a shallow position in order to guide qi outwards from the nutritive level and to disperse it. The qi obtained is moved and led out. The tonification and sedation methods of later generations were thus developed. The needling techniques described in the Ode of the Golden Needles. Jinjiang Fu is a classic on needling techniques. It comes from the Zhenjiao Dachuan compiled by Xu Feng, an acupuncture expert at the beginning of the Ming Dynasty. "14 Methods for Needle Manipulation." In the book, the basic needling techniques were summarized in 14 words. Nail, cut, shake, retreat, move, advance, follow, check, spring, twist, coil, stroke, press, and lift. Nailing method. Press the point with the nail of the thumb or index finger. Cutting method. Press obliquely with the thumbnail with the purpose of dispersing qi and blood. While puncturing the defensive level, press lightly. When puncturing the nutritive level, press heavily in order to disperse the defensive qi. The nailing and cutting methods are used for the insertion of the needle. Shaking method. Enlarge the needle hole by shaking the needle during the withdrawal of the needle. Retreating method. Slowly withdraw the needle gradually from a deep to a shallow position, and then withdraw the needle quickly from the shallow position in order to avoid bleeding. Stroking method. Press the needle hole after the needle is withdrawn in order to tonify or to avoid bleeding. The shaking, retreating, and stroking methods are all used for the withdrawal of the needle. Moving method. Move the needle by lifting, thrusting, and twisting manipulations. Advancing method. Insert the needle downwards or obliquely while manipulating the needle. Moving and advancing methods are to promote the arrival of the needling sensation. Following method. Knead with the hand above and below the point along the meridian when the needling sensation does not arrive or is not sufficient. Usually, this is used for deficient conditions. Checking method. Knead around the point when the needle is stuck or when pathogenic qi is in excess in order to disperse pathogenic blood and qi. This is usually used in excess conditions and can also be used for stuck needles. The following and checking methods are used to circulate the qi. Twisting method. Twist the needle in one direction. This is a method which expels pathogenic factors. Springing method. Spring the needle handle with the thumb or index finger to cause the needle to vibrate. This has a stimulating function and can be used to tonify deficient conditions. Coiling method. This is used for the points on the abdomen. After the needle has been inserted for about 2 minutes, the needle is then bent downwards and circled in a clockwise or counterclockwise motion. It is useful for relieving pain and spasms in the abdomen. Pressing method. This increases the needling sensation by adding pressure downwards after the arrival of the needling sensation, even though the needle is not inserted any further. Lifting method. A method of drawing up qi by lifting up the needle after the arrival of the needling sensation, though the depth of the needle is not altered. The 4 methods of flying the meridians and circulating qi. The 4 methods of flying the meridians and circulating qi are also named the dragon, tiger, tortoise, and phoenix methods. These manipulations promote the needling sensation by dredging the meridians and connecting the qi. Blue dragon swings tail. Insert the needle either shallowly and obliquely or deeply at first, and then shallowly with the needle tip directed towards the diseased area, followed by slowly pushing the needle handle. This method promotes meridian qi to circulate and flow to distant regions. It enables one to control and increase the needling sensation. White tiger shakes head. Insert the needle with the twisting manipulation, then pluck the needle body with the middle finger, causing the needle to shake to the left and right. Afterwards, shake and lift the needle upwards. This method promotes meridian qi flow. Aged turtle probes cave. Withdraw the needle to a superficial level after the arrival of the needling sensation. Then change the direction of the needle point upward, downward, left, and right, and insert obliquely. This method is applied to a big area and to points on thick muscles. It is used to promote meridian qi flow. Red Phoenix welcomes resource. Insert the needle to a deep level. After the arrival of the needling sensation, lift it to a shallow level. Wait for the needle itself to shake, then insert the needle to a middle level and lift, thrust, and twist. This method circulates the meridian qi and treats paralysis. Eighth methods for treatment of diseases. This refers to the 8 kinds of needling methods to treat diseases. Setting the mountain on fire. Insert the needle to the shallow level. After the arrival of the needling sensation, thrust the needle heavily and lift the needle lightly 9 times. Next, insert the needle to the middle level, and after the arrival of the needling sensation, thrust the needle heavily and lift lightly 9 times. Continue to insert the needle to the deep level, and again, after the arrival of the needling sensation, thrust the needle heavily and lift the needle lightly 9 times. Finally, withdraw the needle and press the point. Penetrating the heaven cool. Insert the needle into the deep level. After the arrival of the needling sensation, lift the needle heavily and thrust the needle lightly 6 times. Lift the needle to the middle level, and after the arrival of the needling sensation, lift the needle heavily and thrust the needle lightly 6 times. Next, lift the needle to the shallow level. After the arrival of the needling sensation, lift the needle heavily and thrust the needle lightly 6 times. Withdraw the needle without pressing the point. This method comprehensively applies the needling techniques of sedation and enables the patient to experience a cool sensation. Indicated for heat syndrome of the muscular type, this method is applied to points on thick muscles. If these two methods do not produce a cool or warm sensation after needling all 3 levels, they cannot be reapplied. Yin hidden within yang. Thrust the needle heavily and lift the needle lightly 9 times at the shallow level. Then lift the needle heavily and thrust the needle lightly 6 times at the deep level. This method offers tonification first and sedation afterwards. It is used for cold condition initially and then heat condition afterwards. It is also used for the excess within deficiency syndrome. Yang hidden within yin. Lift the needle heavily and thrust the needle lightly 6 times first to the deep level. Then thrust the needle heavily and lift the needle lightly 9 times to the shallow level. A heat condition is treated first, then a cold condition is addressed. It is also used for treating the deficiency within excess syndrome. Pounding mortar in midnight and noon. After the arrival of the needling sensation, press the point firmly and then lift the needle slowly while twisting 9 times to the left. Lift the needle quickly and press the needle slowly along with 6 twists to the right side. This method can be used repeatedly and is able to be combined with tonification and sedation together to regulate yin and yang and dredge the meridians. This method is indicated for edema and abdominal distension due to the stagnation of qi. Fight between dragon and tiger. After the arrival of the needling sensation, twist the needle to the left 9 times, then twist the needle to the right 6 times. The method can be conducted repeatedly and is indicated for all kinds of pain. Qi entering method. The qi entering method is used to tonify the deep level. After the needle is inserted to the deep level and with the arrival of the needling sensation, apply this tonifying method by pressing the needle firmly and lifting the needle slowly 9 times, and then retaining the needle for a while. The function is similar to that of the fight between dragon and tiger method. Qi remaining method. This is used to tonify the middle level. After the needle is inserted into the middle level and with the arrival of the needling sensation, press the needle firmly and lift the needle slowly 9 times. Then thrust the needle to the deep level and then lift the needle to the middle level. Its function is to disperse qi and is used to treat masses in the abdomen. Drawing adding method. After inserting the needle, lift, thrust, or twist the needle 9 times. After the arrival of the needling sensation, lift and thrust the needle in multiple directions. Then direct and penetrate the needle downwards. This is used to treat paralysis and boils. Other needling techniques. In addition to the Neijing, Nanjing, and Jingzhenfu, needling techniques were also recorded in various other works on acupuncture, which have played an important role in clinical practice. Now we will give a brief account of these methods. Needling techniques for acupoint penetration. The acupuncturists in the Jin and Yuan dynasties utilized the needling technique of penetrating 2 points with one needle, where one needle acts on 2 points in different directions, angles, and depths in order to increase the intensity of stimulation. Perpendicular penetration. This is used for the corresponding points on the medial and lateral sides of the posterior and anterior aspects of the 4 limbs. For example, one can insert the needle from Hogu and penetrate towards Houxi for treating contracture of the fingers. Transverse penetration. This is used for the nearby points in the superior, inferior, anterior, and posterior positions. For example, a needle can be threaded from Di Cang to Jia Che for the treatment of facial paralysis. Multiple direction penetration. This is used to penetrate several points with one needle. For example, the needle is inserted into Jinyi and then threaded to Jiquan after the arrival of the needling sensation. Then the needle is lifted and threaded to Binao for treating joint pain of the shoulder in a large scope. Swiftness in needle insertion. Hu Rouyu of the Jin Dynasty wrote in Liu Zhu Zhi Wei Fu that important thing is to be swift in the insertion and be slow in the penetration of the needle after it's inserted. It is important to be slow in the withdrawal of the needle, as injuries are caused by swiftness. When inserting the needle, it is necessary to insert the needle quickly through the skin in order to avoid causing pain. After the needle tip is inserted through the skin, push the needle slowly to the required depth. After treatment, lift the needle slowly till just under the skin, then quickly pull it out. Insertion and withdrawal of needle with cough. Liu Jin of the Ming Dynasty wrote of his teacher Chen Hui's method of inserting and withdrawing the needle with cough in his book Shen Yin Jing. He stated that, press the point with the finger of the left hand. Take the needle with the right hand and hold it above the point. Ask the patient to cough, and at the moment of coughing, insert the needle. When taking out the needle, ask the patient to cough again, and at the moment of coughing, withdraw the needle. This method is used for sedation. On the basis of insertion and withdrawal of the needle in accordance with respiration, Master Chen developed this method of coughing to distract the patient's attention while inserting and withdrawing the needle in order to decrease pain. Yang's needling techniques. The rich contents of the Zhengzhou Dacheng, compiled by Yang Zhizhou, a well-known acupuncturist specialist in the Ming Dynasty, cited and recorded the needling techniques of various schools. Part of the book discusses in detail Yang's own needling techniques. Midnight Noon Tonification and Sedation Method. A method of twisting manipulation for tonification and sedation. Twisting the needle towards the left promotes the yang qi circulation and is regarded as tonifying. Twisting the needle towards the right circulates the yin and is regarded as sedating. The tonification and sedation are chosen in accordance with the nature of the disease. Ascension and descent of dragon and tiger. A method used to circulate qi. First, the needle is twisted forwards into the point with the thumb of the right hand. Then the needle is twisted forwards with the thumb of the left hand. After the arrival of the needling sensation, the needle is twisted, lifted, and thrust simultaneously. Qi transporting method. A sedation method. After the needle is inserted perpendicularly, the needle is lifted, thrust, and twisted 6 times. After the arrival of the needling sensation, the needle tip is inserted towards the treated area and the patient is asked to inhale deeply 5 times, which enables qi to be transported to the treatment area and to stop pain. Qi lifting method. Also a sedation method. After the needle is inserted, the needle is lifted heavily and thrust lightly 6 times. After the arrival of the needling sensation, the needle is twisted slightly and lifted lightly for the withdrawal of the needle. It is also used to relieve spasms and to treat intractable bee syndromes accompanied by coldness and numbness. The classical needling methods are a valuable heritage bequeathed to us by acupuncture specialists throughout history. They offer important guidance to present-day acupuncture therapy. The inheritance and further development of this knowledge is an inescapable duty of modern-day practitioners. The research into the mechanism of acupuncture have been conducted in various parts of the world, and satisfactory achievements have been obtained. The fruitful achievements give new vitality to the ancient needling techniques.
路漫漫，披迹相伴，